Module 2, XR for clinicians and nurses. Lesson 3. VR's role in enhancing clinical workflows. Welcome back. In today's session, we're diving into how virtual reality, VR, is enhancing clinical workflows. This is an exciting topic because it bridges the gap between cutting-edge technology and the day-to-day realities of healthcare. My name is Januario Sana, and I'll guide you through how VR is transforming the way clinicians and nurses work, improve efficiencies, and ultimately deliver better care. To set the stage, let's begin with a simple truth: healthcare workflows can be incredibly complex. From routine administrative tasks to high-stakes procedures, clinicians face immense pressure to perform efficiently while ensuring patient safety and satisfaction. Historically, innovations like electronic health records and telemedicine have helped streamline certain aspects of healthcare delivery. Now, VR is stepping in as a powerful tool to address both operational and clinical challenges. When we talk about VR in clinical workflows, we're referring to its ability to create immersive, interactive environments that support healthcare professionals in three key areas: preparation, execution, and reflection. Let me unpack these for you. Preparation. VR is increasingly used to prepare clinicians and nurses for procedures. For instance, before a complex surgery, a team can step into a virtual operating room that replicates the patient's anatomy based on imaging data. This allows them to visualize and practice the procedure in a controlled environment, identifying potential challenges and reducing risks. Execution. During procedures, VR can provide real-time guidance or enhance focus through distraction techniques. For example, in vascular access procedures, a nurse might use an augmented VR overlay to visualize veins with higher accuracy, minimizing multiple attempts and improving patient comfort. Reflection. Post-procedure, VR can be used for training and debriefing. Clinicians can revisit the virtual procedure, analyze performance, and identify areas for improvement, fostering continuous learning. Let's take a closer look at some real-world examples of how VR is already being used to enhance workflows. In vascular access. As many of you know, vascular access is a critical skill for nurses. However, achieving successful insertion on the first attempt can be challenging, especially in pediatric or elderly patients. VR can assist by providing virtual training modules that simulate various scenarios, allowing nurses to refine their skills before performing the procedure on actual patients. In rehabilitation units. VR-based rehabilitation programs are transforming workflows by reducing the need for constant supervision. Patients can engage in immersive therapy sessions independently, while clinicians monitor their progress remotely. This not only improves efficiency but also enhances patient engagement. In ICU and critical care. VR is being used to train nurses in high-pressure scenarios, such as managing ventilators or responding to code situations. Immersive simulations replicate the stress and complexity of real-life emergencies, helping clinicians build confidence and resilience. In patient education. Beyond staff training, VR can be a tool for educating patients about their conditions or upcoming procedures. For example, before undergoing cardiac surgery, a patient can use VR to explore a 3D model of their heart, guided by their physician. This improves understanding and fosters trust. Research strongly supports the efficacy of VR in enhancing clinical workflows. A study published in BMJ Simulation Technology Enhanced Learning, 2021, found that VR-based training improved procedural accuracy by 29% and reduced training time by 32% compared to traditional methods. Another review by R. Abbas et al. Highlights the possible correlation between virtual reality training and improvement of patient outcomes. One of the most valuable aspects of VR is its ability to save time, a precious resource in healthcare. By providing immersive training opportunities, clinicians can acquire and refine skills faster than through traditional methods. VR also reduces the need for repeated manual supervision during training sessions, freeing up senior staff to focus on patient care. Furthermore, VR can streamline decision-making. Imagine a nurse in an emergency department accessing a VR module to quickly refresh a protocol for managing sepsis or respiratory distress. This on-demand learning capability can significantly enhance workflow efficiency. Of course, integrating VR into clinical workflows isn't without its challenges. Cost remains a significant barrier, as high-quality VR systems can be expensive to implement. Additionally, there's a learning curve for staff unfamiliar with the technology. It's essential to provide comprehensive training not just on clinical content but also on how to use the VR tools themselves. Another consideration is ensuring the technology fits seamlessly into existing workflows. VR should enhance efficiency, not disrupt it. This requires thoughtful implementation, with input from frontline staff who understand the practical realities of healthcare delivery. Beyond individual benefits, VR has the potential to transform how healthcare teams work together. Collaborative VR platforms allow multidisciplinary teams to train and plan procedures in shared virtual environments, even if they're physically in different locations. This is particularly valuable for complex surgeries that require input from multiple specialists. Now let's take a look into the future. As VR technology continues to evolve, we can expect even greater integration into clinical workflows. Advances in artificial intelligence and real-time data processing will make VR systems more adaptive and personalized. Imagine a scenario where a VR training module adjusts its difficulty based on the user's performance, providing tailored feedback in real time. Moreover, as VR hardware becomes more affordable and portable, we're likely to see wider adoption in outpatient settings, home care, and community clinics. This democratization of technology will further enhance workflows and bring the benefits of VR to diverse patient populations. In summary, VR is not just a futuristic tool, it's a practical solution that is already enhancing clinical workflows in meaningful ways. From training and education to patient care and teamwork, VR offers clinicians and nurses opportunities to work more efficiently, effectively, and confidently. Thank you for joining me for this session. In our next lesson, we'll explore how VR is transforming professional training for clinicians and nurses, providing opportunities to build and refine skills in entirely new ways. I'll see you then.